Just let me change the see, hang on, let's see if we can change the title for this. Boom. Oh, I hope I can change the title of this thing. I'm not even sure. Hey guys, hi everybody. Hi to guys on TikTok, hi to guys on YouTube. It's been a while since I came live on TikTok in particular, but you're welcome. Quick one today. We're just going to cover a couple of viewers' questions and comments, and then take things from there. Hi, if you're watching on YouTube, hi guys. Let me know where you're watching from. And yeah, if you just bumped into me for the very first time, hello, I'm Dr. Sylvia. I'm a GP based in the United Kingdom, and I share health information as a women's health expert around women's health conditions, sexual and reproductive health care, and things in that direction. But I'm also a general practitioner, so I have my hands in everything. Hope you're doing well. Welcome to the weekend. And yeah, let's just get straight into today's live stream, because I don't want it to be too long. So there are two particular questions that prepped my interest. So sorry if I'm looking this way, I'm just reading off the computer. So let's get with the first one. The first one is around fibroids and pregnancy. No, let's do that one second. Yeah, the first one we're going to do is around Depo and delayed fertility. And I think this is a question, this is a common issue. I get this question a lot. And so if this is something that you've dealt with or you're dealing with, please let me know. Hi guys, let me just quickly say hi to people. I'll just do that for a couple of minutes. Hi Gunjan from Delhi, India. Hi, good to see you. And hi Amanda, Alice, hi. And Sister Sherry Sample, hello. Sister Sherry Sample Carpenter, hi from Virginia. You're very much welcome. Thank you so much for joining the live. Okay, guys on TikTok, hi to you as well, or if you're watching on the replay. So let me read this quickly. And so the poster says, hi, I've been on Depo for 6 months, but around the time to get another shot, me and my boyfriend are trying to start a family together. So we had sex. But it's about to be 2 weeks and my body doesn't feel right. I'm very bloated. I get tired very easily, hungry all the time, can't stay in the heat for too long or I'll faint, and I'm getting very crazy mood swings. I need your help to let me know what's going on, because I don't know. Thank you. So there's a lot there. And let's tackle this. So first and foremost, as there is a disclaimer on the channel, let me give my disclaimer. Amanda is from Canada. Hi, Amanda. Good to see you. Thank you for joining. And yeah, let's get into this, right? So yes, I was going to talk about the disclaimer. So guys, it's really important to say that we're sharing health information to help educate ourselves and not to give specific advice. I would always say, please, any medical condition, go and speak to the doctor that knows your medical background. You can sit right in front of them and they can examine you and do tests and all that. So we can definitely provide health information that's evidence-based. I'm a GP, I'm licensed to practice, and I work with evidence-based information, science-based information. So we can definitely talk around things, provide explanations. But when it comes to making specific decisions about your health, please always speak to your doctor. So thank you to this poster for sharing this question. I really appreciate it gives me the opportunity to share information, because if just one person is asking about it, then you can bet that a few other people also thinking about this. And it's a fairly common scenario. So the Depo shot is a really effective contraceptive, and it's the injection that contains a large amount of progesterone that is given every 12 weeks or every 8 weeks, depending on the brand. So it goes by injection. And then after that, you are protected for up to 3 months before the next shot is due, or before your next dose of the jab is due. And like I said, some could be 8 weeks, depending on the brand that you're taking. So let me see. So I'm just looking on TikTok to see what we're doing. Are we actually live? I'm not even sure. Okay. Oh, yes, we are. I wasn't sure. So people are just joining. Okay. So where was I? So I was just describing the Depo shot, and many women use this method of birth control, find it very effective for their needs. And I have quite a few videos on the channel talking about the Depo shot as well as its side effects, because there are also quite a number of women who have really horrendous experiences, and that doesn't surprise me because we're all so different. You can have one basket of people that have only good things to say, while you have another group of people who it's a complete nightmare. So I totally appreciate that. So the key thing to remember is it's a big injection, and when you get it, when you've taken it, the amount or the quantity of the birth control begins to gradually work its way out of your system over time. So you get the big shot, and then it's doing its job. By the time it comes for the next shot that's due, then the level of protection is usually lower, is reducing as the days go on. So it seems to me, now this poster hasn't specifically said what happened, but it does seem to me as if they didn't have the next shot, and then they met with their partner. And so I have a few questions to ask, because the effect of the shot is going to start wearing off as you get close to when it's next due. And so the first question I want to ask is, well, if you'd had sex close to that time, then the chance of pregnancy is there. And the thing is tricky. You've mentioned all these symptoms that you've had. Let me read them, because she was very, very, very detailed on the symptoms. She said her body doesn't feel right. She's bloated. She's tired, easily hungry all the time, can't stay in the heat for too long or she'll faint. So all of these things many women would associate with very early pregnancy, to be honest with you. So whether it's that you're pregnant because you already, the concentration of the shot was already lower because you were getting near to the next dose, or the other possibility is that, okay, it's not pregnancy, but it's an effect of hormone fluctuations in your system. So this is why I always say, we can't provide specific health information on social media, not on TikTok, not on YouTube or Facebook or wherever. I always say, please go and see your doctor. But in this instance, I would say to you, in addition to that, the first thing I would think about is do a pregnancy test. That's the very first thing. I don't know what your periods are like while you've been on the shot. I don't know what's been happening with that. But I wouldn't even use that as a guide. I would simply go and get a pregnancy test done first. And if it's positive, of course, you have to go and see your doctor. If it's negative and you're still having these symptoms, you still have to go and see your doctor. So this is one where it's challenging to say what could be happening, because a test would really help and clarify what the situation is in terms of this regard. So I understand that you're feeling really uncomfortable, really unwell. I mean, you do sound as if you're going through a lot, and I am so sorry to hear that. But it's important to realize that pregnancy is a possibility given the timing when you had sex. So what I'm trying to say is that after you've had the shot, the concentration and therefore its protection starts to wane by the time you're getting to the next shot being due. So that's why you need to have the next shot at its due date. And that's what you'll be told when they've given you, or when you've been prescribed the injection, because some people can give it themselves. You'll be told when the next shot is due, so that you're properly protected and you don't feel as if, it's there endlessly. So this is in terms of how it protects for pregnancy. So to the original poster who's trying to understand what is going on, two possibilities just given your description. The first being that it could be that you're pregnant, okay, because you were close to the time of the next shot and therefore the cover was probably down. Or it could be that it's hormone fluctuations, or there could be something else going on. And I would recommend that you go and see your doctor. So thank you again for sending in that question. Hi guys, thanks to everyone who's joining on TikTok. Thank you so much for joining. And wow, I'm seeing something about a gift gallery, which I don't know what it means, but maybe it's just information. But thanks to everybody on TikTok. I don't know if you're finding this useful. There's so many people, I can't go through all the names, but thank you. So back on YouTube, Sonia Burton says, hi Sonia, how are you doing? I'm going to be talking a little bit about fibroids in the next question. So I'm not going to be able to address anything that's outside of the topics that we're looking at. Gunjan, if your doctor said that you should be put on Mirena to help, that is one of the options. If you're struggling with irregular and painful periods. So that's one of the options there. And it's worthwhile trying because it contains the hormone. So that can help in terms of balancing, providing some balance into your system, and could help to reduce the the heavy bleeding that you're getting from the periods. And with that, it might also help to counter the effect of the womb cramping that's causing the pain. So I think it's worthwhile trying. Your doctor knows your medical history and will be able to advise better. And again, depending on the different methods or options that you've tried, there are a few different ways. And I think it's individual for each person. So, yeah. So I would think it's worthwhile sort of, seeing, you can give the Mirena a try. I don't know what options you've used before, but you can definitely give that a try, especially if it's been recommended by your clinician, and then see what the benefit is. For some women, it does make a real significant difference in lightening the bleeding and also helping with the pain. Okay, so thank you so much to that original poster. I hope this is helpful. The two things I want you to take away from this are the possibility of pregnancy, really important. And the second thing is, regardless, you're not feeling well, please go and see your doctor, explain the symptoms to them so they can have a look, do some tests and take things from there. Right, thank you. So the very next question, this is the one that's to do with fibroids. So where is it? I'm just looking for it to read the question. Okay. Oh, yes. So this is, thank you so much to the poster. So this person says, hi, doctor. I have 2 large fibroids, 8 centimeters and 10 centimeters in front of the cervix. Would cesarean section be best since the fibroids are blocking the way out? So again, thank you for the question. Thank you so much for the gift. Hi. This is from on TikTok. Thanks for the follow as well. That's really appreciated. So this is Dove, yeah, is it Dove UK? Yeah, I think so. Dovic. Send guardian wings. I appreciate that. I'm not sure exactly what that means. That goes to show you just how familiar I am with TikTok, but I really appreciate that and for your presence here. And Gunjan on YouTube says, thank you. You're welcome. You're welcome. I'm sorry I can't provide more insight, but I feel reassured that you're speaking with your doctor about this. And I think it's worthwhile going back to them always to discuss the different options and keep in touch. It's not, one size doesn't fit everyone, and it's worthwhile having that conversation. And clearly it's something that you're struggling with. It's not easy. It is not easy. But please give this a try and see if that helps to make a request, make a difference for you. Okay, right. So we're dealing with the story of 2 large fibroids, 8 centimeters, 10 centimeters. So they are large. You guys, for those who know our fibroids discussion, we have whole fibroids tutorials on the channel as well. So these are large fibroids. And don't forget that what is important about fibroids is not just the size, it's also the number. It's also the, hi Dovik, how are you doing? Thank you so much for the support, really appreciate it. So it's not just the size, it's also the number and where they're located. Okay, so we've got 2 bits of information here. Oh, in fact, we've got all the information actually. So we know there are 2 of them. They're large, and they definitely are, because 8 cm and 10 cm are quite, in terms of the size of a pregnant womb, they are, they'd be considered significant. Will cesarean section be best since the fibroids are blocking the way out? So again, my disclaimer: this is an important, very important question that you should have with your doctor, with your specialist. And if you're just joining, thank you so much. I can see there are a few people joining in from TikTok and on YouTube. Please don't forget to give this video a like. I would really appreciate the support. And yes, for those who are in the UK, I keep forgetting to say this, but for those who are in the UK, yes, we do have online doctor GP consultations, especially in women's health areas, on my platform, yourgpconsultation.com. I'm sure there's a link in the description in both of these platforms. So that's for UK residents, because I can provide this clinical care directly for people in the UK because I'm registered to practice and licensed to practice here. So if this is you and you want to sort of take this further, have further conversations, and you're based in the UK, yourgpconsultation.com is the place to find me. But back to what we're discussing. So I would definitely recommend that you're sitting down with your doctor, and I'll be very surprised if you haven't done that already. And I think they've probably said this to you, and so you're looking for a second opinion, which is fine. I totally I support that. So yes, the size and where the fibroids are located is very important. So not just whether they're, entering into the womb cavity or jutting into the womb cavity, but also whether they are located close to the neck of the womb, the cervix, because, as the womb expands out of the pelvis and into your abdomen, when it's time for labor, then you need that path, that entire channel close to the cervix open. It's even the cervix that things that opens up. That's the channel through which the baby's head is going to come through. So it absolutely makes sense. Think of it like mechanics, that there will be something blocking the way, because the fibroid tissue is yes, it's womb muscle, but it's distorted womb muscle. It's not going to behave the way that the rest of the womb will behave when it comes to pregnancy and labor and contraction. So it will form an obstruction. So yes, it does make sense that this type of fibroid, with this size of fibroid, with this location of fibroid, that yes, your clinicians will be thinking about and should be discussing with you the possibility of a C-section, and probably a planned C-section, because they'll be concerned about the likelihood of the fibroid blocking the channel through which the baby is going to come through. So imagine if it's like a tunnel and there's like a rock or a big boulder or stone, blocking part of that tunnel. How is the baby going to go through? So yeah, they would probably recommend something like a planned C-section. Now, please, very, very important, because I do think there's still some people who are afraid of surgery like this, or who feel that they are less of a woman. Please don't feel that way at all. There's nothing like that. In fact, you're being so responsible to be thinking about this, to be proactive in considering the possibility and being guided with the right information that will serve both you and your baby, so that you have both healthy mom and baby at the end of the story. And so just think about it as, this is the path that you're going through. This is your own journey. For some other people, okay, fine, they have a vaginal birth, or they have a forceps birth, or something else. I would really prefer that it's a C-section is planned, so the doctor, the midwife, the pediatrician, everybody is prepared and ready for delivering this baby safely, and not a situation where you want to risk trying to push this baby out, knowing that there are fibroids in place that will not behave themselves because they are irregular tissues or muscle aspects of the womb. So you have to be very careful in thinking about it. I think they've given you the right direction. It's important medical advice that your doctors have provided to you. So when they hold or do the C-section, they'd be able to carefully cut into the womb to bring the baby out, avoiding the potential of, apart from, we're talking about blockage, what about, bleeding? Because like I said, fibroids don't listen. They can, anything could happen. So why take that risk through a vaginal birth? So the key thing is that with a planned C-section, you're going to be monitored. They're going to check, they're going to keep tabs on you, plan when you're going to have your procedure, and everything that needs to be in place. And so nobody's taken by surprise. This is why it should happen. Now, again, I'm not giving you specific advice for this situation. I am saying that, yes, this would be considered in this kind of scenario. What should you do if you haven't already is to go and sit down with your gynecologist, your obstetrician. If you're not already under them, if you're pregnant, for example, at this point, and you have this fibroid, then of course you should be under their care. If this is something that you're thinking about, you're not pregnant yet, I would still recommend that you should be referred to them if you're, already planning your family, so that they can look at what are the best options. You should even be under the care of a gynecologist, obstetrician before you get pregnant with this type of fibroids. I mean, I'll add in here that, like I've been saying it now, that fibroids can do anything. In some women, fibroids may shrink in pregnancy. Not in everybody. So that means that whichever outcome yours is, if you're already under the care of the obstetrician, then you're in the right place, in the right hands to know how to manage the fibroids. Okay, so that is that for that question. I think we've covered, what did she want? Let's look at exactly what she wanted to know. She said, would cesarean be best since the fibroids are blocking the way out? I think you've answered the question, my love. I think you know, and I'm happy to provide you that sort of second opinion as to what can happen potentially. Many women like you in this particular scenario have had successful births, pregnancies, deliveries, via C-section. The fibroid didn't stop them from having their children, whatever number of children that they wanted. So you can definitely experience the same as them. Guys, this is what we have the time for. Thank you so much. Thank you so much. Dovik, you are amazing. I'm seeing all sorts of things popping up on TikTok. I really need to go and study it and find out what is going on. But Dovik, you've become the #1 fan. Hooray! You're my #1 fan on TikTok. Thank you so much. I appreciate your support. And thank you guys on YouTube. So there is a message here. I think I missed it. Let's see what happened. So Amanda says, endometriosis and fibroids, having a hard time getting pregnant. I hope you're under a specialist at this point to look at options. And Gunjan is saying a little bit more about the Mirena. Okay, yeah. And Capricorn says, hi, hello. And Amanda says you had surgery to remove them from the womb, but still have some of them at the side. And let's see. Oh, Capricorn says, I have stage 4 endometriosis. They found it during my fibroid removal, 35 with no kids. I'm sorry. I'm sorry. I think that would have been so disturbing, so distressing to hear, and I'm so sorry. You know, there are different things that different things that one can think about. You know, depends on your mindset, depends on what you're prepared for. Never say never. Never say never. Okay, I think they're different. You know, we all have different options, and it's worthwhile, like I always say, to sit down with your specialist and say, okay, what is it that I can do? How can this be treated? What is the next step? I know stage 4 is quite advanced endometriosis, and I don't know whether you're dealing with other symptoms apart from the challenge of having children as well. But sitting down with a fertility specialist to say, this is my dream. Okay, how can I have a child? What are the steps? Because thankfully today there are other different options that we can look at, whether it's by assisted birth or other suggestions, if that is something that you're open to. I think the first thing is having that conversation around your condition. Okay, so and hi, OI says, I have 15 centimeter fibroid, age 44. No symptoms. However, the doctor told me to remove by surgery after the doctor told me to just watch it, which is right. And also HIFU, non-surgical. Yeah. So usually, we would say to watch. Did you how many centimeters? 15 centimeter. So we're just talking about an 8 and 10 centimeter fibroid. So 15 centimeter fibroid is large. And the doctor says, even though you don't have symptoms, the doctor says to remove them. And then another doctor says to just watch it. So, these are conversations to have. Why would the doctor say remove them? Now, could they be thinking ahead? Because the fibroid, if it's not showing any sign of shrinking in the last few years, perhaps they're thinking that this is going to continue growing bigger, and then it could cause some obstruction. I don't know. I wasn't there, and I think it's worthwhile asking the doctor why are they recommending removal of the fibroid? And there are different mechanisms, there are different processes. So the procedure you referred to there is, focused ultrasound, which is one of those non-surgical methods that we can use to provide heat therapy to a fibroid to shrink it or to kill off the tissue. So of course, it has less potential complications or side effects compared to the things like surgery, cutting or myomectomy and so on. So it's theoretically a preferred option. And if you're suitable for it, because it's not just anybody or everybody, you have to be eligible and suitable for that procedure. So it's I think it's something that could be considered. I like having conversations with my patients, and if the doctor makes a recommendation, it's good to say to them, what are the pros and cons? What are the reasons? If I don't have it taken out, what do you think might happen? So that there's a whole conversation, and you can go and have that. You can go away and make the right decision. So I can't tell you, which is right or which one you should go with, I would suggest that you go back and talk about go back and speak to your doctor about it. So I'm referring to Bawai's question about the 15 centimeter fibroid. Amanda was talking earlier about endometriosis, stage 4 endometriosis was what I was referring to, because I think you'd mentioned that you'd had that and it was detected when they were operating on you. So sorry if I was causing any confusion. I was just looking at the comments as they were coming in. So Bawai, that's my thoughts about the 15 centimeter fibroid. I think it's good to go back and speak to the doctor. What are they thinking might happen? What is the possibility that could happen if you don't have the operation? I've given you one example, because fibroids, if they grow, and there's every possibility that they can continue to grow, can cause some obstruction, even though there are no symptoms now. So they may be thinking ahead about what could happen potentially, and so that's why they're looking at it. And you also asked about the procedure, focused ultrasound, and I've explained that it's one method that you can use to remove or shrink fibroids by applying some kind of ultrasound treatment towards the fibroid to shrink it, and it has less complications compared to something like myomectomy, where you're cutting into the body to remove and cutting away the fibroid. Okay, guys, so let me just have a quick look at TikTok. Thank you so much, Dovik. I think we're going to end it in a minute. And guys, thank you so much for joining. I really appreciate you. Thank you so much for your time. And yes, don't forget, if you're based in the UK, your gpconsultation.com is the place where we can have a conversation and talk about different medical issues. Like I said, I specialize in women's health conditions. Happy to engage with you and look at how best to take things forward for your healthcare. So thank you so much for watching, guys. I appreciate you. Thanks to those on YouTube. Thank you so much for the questions. I hope you found the conversation useful. In particular, thanks to the people who sent in those questions around the Depo shot and around the fibroid and the question around the C-section. Very much appreciated. As you leave, please give this video a like and be like Dovik, who has subscribed to the channel. Much appreciated. And I will see you again in the very next one. Thank you so much, guys. Take care. One more question. Why is it more common in Black women? Okay, so I think I've dealt with that in one of the videos. One of the things that we don't know exactly why fibroids happen more in Black women. There is no specific answer. They can look at so many different factors, from genetics, from geography, from all sorts of different connections. We don't know 100%, but we do know that Black women, whether African American or whether Afro-Caribbean or African, do have higher rates of fibroids. And then I think more research, the thing is that we need more research to work out what the reason for that would be. Okay, so if you have any other questions, you can always post a question in the comment section of the videos, and we can talk about them on a live stream like this. Or like I said, if you're in the UK, hit me up at yourgpconsultation.com. Okay, guys, thank you so much for watching. Take care, have a great weekend, and stay well. Bye-bye. Thank you.